Hey, let me share my screen. All right, so thank you guys for coming today. I hope to share something about my journey as a veterinarian. I'm pretty much an open book, so really no questions are uncomfortable for me in this regards. And if you aren't comfortable asking a question during this presentation, you can always email me, and I'm happy to chat. So just welcome. Thanks for being here. All right, so this is what everyone thinks that I do all day long when I say I'm a veterinarian, snuggle the puppies and the kitties. And I hope to convey to you that veterinarians actually do a lot more than just that. So the these are some pictures of my colleagues and friends, classmates doing jobs as veterinarians. And I think that it's really a lot of people aren't aware about how much that they do for society. So this upper corner here with the WHO is a veterinarian who's a consultant for the WHO on epidemiology, and she was at the United Nations for a meeting. There's a veterinarian here with this hospital room, and she's doing disease surveillance. Bee veterinarians, we know that pollinators are super important, and so there's veterinarians who actually specialize in bee medicine, and then there's a veterinarian who is doing presenting a paper on Chagas disease, which is a zoonotic disease that goes from dogs to people. In the lower part here, we've got a veterinarian who works for the she's a veterinary medical officer. So she works for the government, the USDA, and she was doing surveillance of avian influenza testing in these ducks that were hunted by hunters in Alaska. And then this vet down here, she's in the U.S. Army Corps. She's actually the chief veterinary surgeon for all of Asia, Europe, and Africa in the Army. She directs all of the veterinary medical centers in Europe as well. And then this vet is studying fungal disease outbreak up in the Midwest. And here's a marine vet. Just one more slide. Just again, there's so many cool things we do. You've got your equine veterinarians, your exotic. She's got a little snail here. You got physical therapy rehab veterinarians, specialty vets. This one's a veterinary surgeon. The cow medicine, doing cattle, large type of animals. And then this is another U.S. Army veterinarian who specifically works with the working dogs for the Army. And this vet is a commissioned officer in the Public Health Service. She's a veterinarian and works in like epidemiology, disease surveillance. So a lot of cool things that we do as veterinarians. Just a quick rundown, like there are a lot of veterinarians in the United States, 127,000 of us, and they encompass basically everything I just kind of went over, these different professions. Um, and the majority are going to be your like small animal, dog and cat practice veterinarians. So what people typically think of as veterinarians. You can kind of see some percentage breakdowns here, but we've got people in academia, government, industry. When I say industry, that means like your drug companies, your food, medical, like anything that you might buy at a pet store, that kind of industry. And then this is a breakdown. You again can see that the majority of the vets that are in clinical practice are going to be predominantly small animal veterinarians. So, but there are others doing exotic medicine, specialty, food animal. Um, some of you who are pre-vet may already be aware, but these are the general requirements of trying to apply to veterinary school. It's pretty competitive. Like for UF statistics in 2023, they had about 2,000 applicants and they took 130. And these are just kind of the general scores. So a lot of them, like most professional schools, are going to need letters of recommendation, experience. You have to sometimes take an entrance exam like the GRE, and you do apply through the veterinary medical FMCAS college application service, sorry. So, and there's credentialing after you get out. So I had to take something called the North American Veterinary Licensing Exam in my senior year of vet school to pass to get my doctorate. And then you have to take a state license exam for wherever you're going to practice. Some states will accept licensed from other states and not have to take another exam. But most have their own state licensing exam, which includes like laws of the state and regulations. You can be USDA accredited. So if anybody's ever had a dog or a cat that they've traveled with and they needed a health certificate, or they bought a dog or a cat or an animal and needed a health certificate, USDA veterinarians that are accredited can do that, and that requires additional training. DEA license is your controlled substance license. So, in order to be able to write prescriptions for drugs that are narcotics, you do have to have a special DEA license for that. And then some cities or counties will require occupational license. So, like Orange County here does, Seminole does not. It's just an extra fee you have to pay every so often for that. And then to keep up licensures, you usually have to do some sort of continuing education. So, for instance, Florida requires for me to keep my license for Florida every 30 hours every 2 years. And it does have some specific requirements that go into what those continuing educations have to be. I do think this is something important to highlight to people who are considering going into vet school, really any professional school, is the amount of debt that you can accrue when you're in postgraduate programs, and looking at kind of what you come out at with what you are going to make. And obviously, you're investing in your future anytime you do education, but it is a reality I think that sometimes people forget. Personally, in 2010, when I graduated, I came out with about $150,000 of debt. My career in veterinary medicine, the average income was a lot lower than this. Um, I think I was on the lower side, but I made $65,000 my first year as a veterinarian. So it's definitely increased, and I think that it's gotten a lot more competitive in the market for new vets coming out, so they make more. But it's still a reality is you're not necessarily making MD money, you're making DVM money, and that's a lot less. So the also a lot of veterinarians are paid in the clinical setting based on a salary plus production. So you're offered so much to start, but then in order to make that higher number, you actually have to sell more. And when I say sell more, that means that you're doing procedures, you're giving vaccines, you're doing exams, you're prescribing medications. And so that's a reality I don't think that people often know about their vet. Now, personally, and I think the majority of us never really practice to make money. And so it wasn't like I was going into an exam room saying, oh, how much can I sell today to make more money? That's not what most of us are doing. It's just the reality of how the veterinary community has set up their compensation. And then there are hazards associated with our profession. I would say mainly this is in relation to being in the clinic. And this goes for small animal, large animal, equine veterinarians. You are exposed to a lot of diseases that you can pick up from your patients. Personally, I am rabies vaccinated, and I do have my titers checked pretty regularly. In case I get bit. These other diseases here, some of them you may have heard of, but they are, go from worms. Essentially, you can get worms from your patients. So always wash your hands before you eat a sandwich. But things that can be a little bit more serious, like leptospirosis, is transmitted in urine in animals, and you can pick that up and can cause some liver and kidney issues. So there's also the actual physical hazards. As you can imagine, working with animals, it can be a very physical job. You are at risk for being bit or kicked, or I say needle sticks because we definitely have where animals have jumped and the needle has flown out of my hand and landed in somebody's body part, an arm or foot. So those two things do happen. I've cut myself when I've been doing surgery. It's very loud in animal environments, whether that's the clinic or if you're working in like food animal and you're in an animal barn, like those are very loud. If you're outdoor veterinarian, you're obviously having to deal with all kinds of weather. Um, I remember one day when I was in my internship in Missouri, it was -4 degrees outside and I was working with horses. So, it's a harsher lifestyle. And then radiation exposure, like you're doing x-rays and things too. And then the emotional toll, which We can go on a little bit more later about, but this is definitely a reality of the profession. Really, any like helping profession, I think you're going to see this. So, our nurses, our doctors, MDs, they're dealing with these things too. So, it's not just us, any really helping, caring profession, you probably will see these, but these are things to note. Um, I think we might get I mean, may get maybe more angry clients because a lot of our stuff is tied to money. And if people have spent a lot of money and don't get the outcome they wish, they can understandably be angry. So I think maybe because our profession, we don't have like health insurance or things like that, um, the money thing becomes a more of an issue. So, um, just about me now real quick, and then we can get into the questions. So people ask like, why did you want to become a vet? I watched a lot of Animal Planet. I think in ninth grade, I did an interview for my veterinarian because I had some dogs and cats. And then I was like, hey, can you let me shadow you? I started really enjoying it. I worked in his clinic and I worked at some other clinics, did some volunteering with like the shelter and things. Just found that I was passionate about veterinary medicine and the actual medicine part I really enjoyed. And then, so I kind of picked my undergraduate career based on that and what the best chance for me to get into vet school. So I did go to the University of West Florida and I had a bachelor's in pre-professional biology. I did a lot of involvement in pre-health student organizations. So like this is one of our pre-health groups. We did Habitat for Humanity. I did do research. I was in the honors program and it was required at the time. So we had to do some sort of research and I worked in an organic and biochem lab. And this is me on my undergraduate graduation day. Um, Went to college, UF's College of Veterinary Medicine. I was actually equine medicine track, which I really got interested in that by working at the UF vet school's equine hospital this one summer before I went to vet school. And I had ridden horses and I had really enjoyed that. So I decided I wanted to do equine medicine. Um, I got even published in equine research, and then I got an internship at the University of Missouri, which I went to afterwards. I put my first life hiccup here because I realized in vet school very quickly that I was not, had never really been academically challenged before this, and vet school was really hard. Really, really hard. I made my first C my first semester and about fell apart. So it was a big like a realization for me that it wasn't going to be easy anymore, but that was okay. And so I do like to point this out to students because, you know, failing for vet school might have actually helped me prepare better to fail a little bit in vet school and deal with that emotionally. And so it's okay if you're not perfect. And I had to realize that in vet school that I was okay to not be perfect. So that was a hard time to learn that lesson. But that's kind of was my first little like, okay. And then I did my internship, which is a year long. Usually it's at a university setting, but there are private internships based on what you want to do. We do have something called the match in the veterinary community as well as people do in like when they go to med school. So I was matched to Missouri. Never been to Missouri in my life. Left my family, my fiance, everything to go up there. And it was a rotating medicine internship in surgery, ambulatory, and medicine. And I did some research while I was there on horses. And then I had my second life hiccup, which was when I graduated, the market had crashed pretty good. There weren't a lot of jobs out there. There was virtually no equine jobs available. I went to a interview with 35 other candidates for one position. And I quickly realized there were no real positions where my fiance was, and said, okay, I need to pivot and maybe go back to small animal. Um, that was a really hard thing for me to figure out. Remember being very upset and angsting over this decision. Things worked out though, but it was something that like okay, plans can change. And again, being flexible and having to learn that lesson. And I did find a job in small animal medicine. And so I moved to Orlando where my husband was. We got married shortly after my internship. And I became a small animal veterinarian for 12 years. And in vet school, you learn it all. And I was very intentional about taking some electives in small animal veterinary medicine. My internship at Missouri, they were very kind and let me do some small animal rotations while I was there, and I just learned on the job, um, and it was okay. So 12 years go by. I had a family. I have twins. They just turned 5. I actually started a college student coffee shop, which is over in Winter Park by Rollins. You guys are always more than welcome to come to it. It's just pretty far from you guys, but it's a free coffee shop for college students, and really like engaging with students there. And in that, plus having a little less satisfaction with my clinical job, I realized that there may be something more for me in education, and that I think I wanted to go change my career up. So that's my third life hiccup here. I just turned 40, so um, midlife crisis, I don't know. But I just realized that they had passions in other places. And so I spoke to a lot of colleagues in the vet world, friends. I have some mentors. I know people in education did a lot of talking. It was about a year and a half of trying to figure out where I should go, and ultimately landed on doing an educational leadership master's here at UCF. Um, and I got a job here in the College of Health Professions and Sciences. So I'm actually an academic success coach over there. And so that has been in the last 2 years that this is all unfolded, and I couldn't say I'm so happy to be where I am. I do still work in the clinic. I have a friend who owns a clinic, and I do work for them on the weekends sometimes. I do enjoy going back just for a day, and then leaving, and that's more fun for me. So I still do that aspect, but ultimately I do want to work in a veterinary college, to work with veterinary students, and student affairs. So that's kind of where my journey is. You've caught me in the middle of that right now, but I'm very happy at UCF. It's a great place to be. And so that's me. I I'm more than happy to answer any questions. I know Steph had some prepared ones too, but like I said, here is my email address. I do meet with students who are pre-vet. I'm involved in the pre-veterinary society that's on campus. I do help them out, and I do meet with pre-vet students outside of my normal role as an academic success coach. So if you email me and you want to meet, I'm more than happy to do that. And Seth, let you take it over.
Thank you so much. That was all very informative. And yeah, thank you. So I do have some questions prepared, but I do invite all the students who are here to ask you questions who want to be vets, to ask the questions either in the chat or raise your hand, like your virtual hand in Zoom, and I'll call you out and you can unmute and ask Dr. Braun directly. But while we wait for those questions to come in, because I haven't seen any in the chat so far, um, I'll start off with um, so how can you go a bit deeper into how you handled the emotional highs and lows of the job?
Yeah, so I very um, pro counseling, taking care of your mental health. So I personally have a therapist that I see on a regular basis, and that helps a lot to manage. I was getting anxiety being in the clinic, getting some burnout, compassion fatigue. So to speaking to my counselor about those things, and leaning on coworkers. In the clinic setting, everyone's very tight. We're very close because it's a very emotionally challenging job for everyone: technicians, receptionists, doctors, kennel staff. So leaning on each other really helps. Just being supportive and listening. My husband, he is a real superhero that he's always hearing my things when I'd come home that I needed to vent and just offload, and trying to process things, and celebrating the wins, obviously, and trying to remember when you've had a really hard day or a really case that just didn't go the way you'd hoped, and people are disappointed, upset, angry. You try to remember, and it can be hard, but you try to remember all the people, patients that you do help on a daily basis.
And piggybacking off of that, what has been the most rewarding part of your career so far?
Yeah, so um, I think that, I was trying to think about this, that I'm realizing now that I'm very excited to be a veterinarian because there's a lot of things that I can do as a veterinarian that aren't in the clinic. And that's been really rewarding to find this new avenue that I can pursue and live my passion out of helping students. And that's made me very exciting. So I think that while if you asked me 20 years ago when I started this whole thing, um, where I was gonna go, I wouldn't have been able to answer that I thought I had other options besides the clinic. So I think that knowing that veterinarians can do a lot of things outside of just the clinical setting has been a rewarding realization for me, and being able to start this new career path.
Thank you. I'm not seeing any questions yet, but start thinking of those. So I'll keep going with the questions that I have. Um,
Hmm.
so what are some common misconceptions about being a veterinarian?
Yeah, so I think I've said this already, but I think that it's that people assume that you're going to just be in a clinic all day and not doing other things that the veterinary roles can do. I think that, people may think that you love your job all the time because you are playing with doggies and kitties all day. So how can that not be wonderful? But there is a lot of hard realities associated with this. We all know about euthanasia. Like I said, people who have outcomes that they did not like, not being able to treat a patient because an owner has doesn't have the money. These are things that you can really struggle with, and so I think that's probably the biggest misconception is that it's not all roses all day. But I think that's also any job. I just think the public has a different view of veterinarians because we help animals. So how can that not be wonderful?
Right. Yeah, that makes a lot of sense. So I did get some questions in the chat. This question's from Angeline. What is the continued education like throughout being a vet? Are there like college classes to keep your license?
Yeah, so it's a great question. I know I briefly touched on it, but it's depends honestly on what you're doing. So it depends on the kind of veterinarian you are. If you're a general practitioner and you just have a state license, then you're going to have to take continuing education that's per the state rules, and that looks like going to conferences and listening to people speak. You can do some continuing education, especially with COVID. You can do some continuing education virtually these days. So you listen to a webinar and you document your hours. If you have any additional licenses or certifications, you would have to follow what those governing bodies are saying. So, like for my USDA accreditation, every 3 years I had to do 20 modules and go through them, and then so proof of completion for that to continue my certification. If you're a specialist, so you have additional specialties, you've done a residency in something, those bodies do also have special things or a separate set of requirements that you'll need to continue getting your specialization certification. So it does vary a little bit on that. It's not usually like classes per se, they're usually seminars, webinars, listening to speakers, going to conferences, and that kind of thing. And you generally document those on the honor system. And you can be audited at any point by the governing agency. I have never been personally audited, but I've had friends. So you do have to document and keep records for those things.
Sounds good. Another question from Alex. How did you deal with people who couldn't afford procedures slash medicine that their pets needed?
So this is a really hard topic, and it's a good question that you've asked. I think that we would all love for everyone to have all the money to do the gold standard for their pets, and that's just not the reality. And also, that's a real thing that new vets seem to struggle with because they come from vet schools. They've done the ivory tower medicine, where people have paid everything, you've done everything possible for these pets, and then you come out to a general practice, and that's not the reality at all. So for me, and I think this did help me always build rapport with people, was offering, you do need to offer the standard of care, but also empathizing with clients and trying to figure out what they can afford and where we need to target what we can. So a lot of times for me, that meant I wouldn't do diagnostics. I would just treat based on the history, based on the exam. Some of that's intuition you learn as you go, but every limping dog that comes in does not need an x-ray. Sometimes some pain medication and rest will take care of the dog just fine. And so recognizing there are spectrums of care, and I think the vet schools are getting better about teaching spectrum of care. It's maybe not something I was taught as much, but that is the biggest thing, is understanding that it is not all or nothing. Um, there are cases where animals may need life-saving care that the owners cannot afford at all, and there's really no other option here. And that's when you have to talk about things like euthanasia. And that can be hard, it can be frustrating for veterinarians who really, want the best for the patient, but their owners want the best too. They just can't afford it, and that's okay. So you have to, again, I would say euthanasia is in the spectrum of care too in those situations. Obviously, I had friends who run various pet organizations in town who sometimes could contribute to cost of care. Sometimes people would get care credit, like a credit card, to help subsidize the cost of care, or have family members help, or sometimes even owners would what we call relinquish a pet. So if there was someone else who was willing to take over the pet's care, um, and then do still keep the pet alive and treated, that was an option too. So you had a lot of options besides just the gold absolute best standard of care there.
Thank you. Another question says, how long did it take slash how did you prepare to redirect your career towards small animal medicine?
Okay, so I assume you mean going from equine medicine to small animal medicine. Um, so as far as that goes, it was in my internship. It started in June. It was probably around January that I came into the realization that that it wasn't going to work out for equine. I needed to go to small animal. And from there, I just started reviewing my notes from vet school. I kept, I keep everything. We had to take all both large and small animal medicine courses. So I would pull out my notebooks, reviewing things. I mentioned that my internship allowed me to um, do some rotations in small animal care while I was there. So I did a few of those rotations, and then just had to, when I did find a job, found a place that had a mentor who was willing to help me make that transition. So I would say that it was, especially once you got into the clinic and the small animal clinic and you're doing the day to day, it was pretty quick to start picking things back up. I had to put a timeline on it, maybe 2 years to really fully feel that I was transitioned back to small animal.
Awesome, thank you. Another question says, how does the research perspective world differ for vets? What has new research been focused on lately within that field?
Oh, that's a pretty broad topic or question. I'll do my best with that. In veterinary medicine, we're doing research obviously for drugs that help our pet population, and like that's probably the biggest focus on like a clinical setting is these newer drugs. But you also remember that a lot of times things that may be being researched in human medicine may have applications in our pets, and same vice versa. Some research is done with pet things can then lead to breakthroughs on the human medicine side. So I think that's a big aspect of research. Um, let's see, what was it? What has been new or lately? I don't know that I could speak to like every research. I do know of newer drugs that have come onto the market, and what they're working with some immune modulating drugs to treat allergies. There's new things that are targeting inflammation like arthritis, from an immune perspective. There's new treatments in pets for diabetes now that are more like metformin in people, so not necessarily insulin injections, but oral medications trying to target that. I think there's continually research on diet and nutrition in pets and treating diseases from that aspect. Purina, Hills, Science Diet, and Royal Canin. Those are big names in the pet food industry, so they're constantly doing research on targeting diet therapy to treat diseases. I hope that answers your question.
Yeah, piggybacking off of that question too with one of my questions, how do you stay updated with the latest advancements in veterinary medicine?
Yeah, so for me, it's going to be, especially because I'm not in the clinic as much, it is reading. I have a subscription to the American Veterinary Medical Association's Journal of Veterinary Medicine. And so I get that. I believe it's every 2 months with journal articles that I read, and other articles. There are some periodicals that like one called Clinician's Brief, which is a great one. If any of you are pre-vet, you actually can go on there and get a free subscription to that magazine. Again, I can put the name in the chat, but it's a great like quick thing. They have a lot of highlights on new diseases or new medications, or, like what's your diagnosis? And they put a case, and you can kind of go through the steps and then see what they say the diagnosis was. So that's a really good thing. My coworkers, when I was in the clinic, my coworkers, but even now, my friend who owns the clinic I help with, I'm always like, hey, what you hearing that's new? So that can be a good source. I still go to conferences. I'm actually going to one tomorrow. And so keeping those things up to date, you have to be intentional. It is something that I think in any professional medical field, you have to be intentional about keeping up to date on things, so that you can offer the best care for your patients.
Thank you. Another question from the chat. Did you get involved in any research? If so, how did you get your foot in the door and work your way up from there?
Okay, so I just put the name of that magazine in the chat for everyone. So research-wise, I did research in undergraduate, like I mentioned, was more in an organic in a biochemistry lab. And so that was kind of non-specific and more because I was required to for my honors project. It probably looked good on my vet school application, but I don't think that was my intention at the time for that. But in vet school, to graduate with honors, again, I guess this is my impetus here, that I had to do a research project. But again, it turned out good in the end for me. I was in equine medicine, like focused it's still at that time in vet school. So one of my clinicians became a mentor. I asked if I could help her in her lab doing research. We were doing research on foals, so baby horses, and we were sticking pH tonometers down through their nose, so nasogastric tube through the nose into the stomach, and measuring the pH in their stomachs for various reasons. Horses have a big issue with stomach ulcers. There's a lot of reasons they get stomach ulcers. There's different drugs that treat it. So we were kind of focusing that and understanding more about how the pH was regulated in our foal population, especially our sick foals that would come in would be more prone to ulcers as well in their stomach, which can cause other issues. So That was how I got involved in that. I enjoyed it. We did get published, so I am published in JAVMA, the Journal of the American Veterinary Medical Association, in internal medicine, and that was exciting for me. In my internship, I did do research. I did a case study because I had an interesting case that came in, something that when I worked with one of my mentors, we could not find having been reported in the literature before. So that was called renal amyloidosis in a horse. And that's these deposits of something called amyloid. It's a protein in the body in this horse's kidneys. And so that was more of a case study based on we ended up having to euthanize the horse and then doing a necropsy and various histopathologies on that. So that's kind of my experience with research. I fell into a lot of it, I guess. I've never been one that like enjoyed it to do as a career path, but I definitely had colleagues, classmates who that was their intention when they left veterinary school was to focus on research or get PhDs and start working in various whatever topics they would choose. So.
And to add a little bit to that question, how do you get your foot in the door? That's what AAP is about. So come visit us at the Career Center on campus. We can help you with a one-on-one meeting and specifically tackle whatever your goals are together to get into research, to start meeting faculty. And I'm sorry that I'm offering you, but you're an academic success coach. So I'm assuming that you also take students and, meet with them and stuff. So yeah, go meet people, go start asking questions, start early, all that good stuff.
Networking is very key. And I don't know if AAP has offered this, but I have seen networking workshops on campus. And learning how to network is a skill and it can get you a lot of places. So I do stress that as an academic success coach that networking helps. And one of those networks is going to be, like she said, talking to you, you AAP ambassadors and just trying to see like what opportunities are out there.
Yeah, well, we'll connect you to the best people around campus. It can be overwhelming that there's so many opportunities, so we'll direct you. All right, another question from Angeline. What do you recommend students do if they are struggling to find a mentor veterinarian willing to teach, especially since vet schools normally require a letter of recommendation that seems very important to the process?
Yes. So, first of all, you're not alone if you're struggling with that. I think that's a real issue for students these days that I see. Networking is a big part of that. Like I just mentioned, putting yourself out there, emailing, going in person to vet clinics, asking if you don't see a veterinarian because you don't have a pet yourself, asking any family members who have a veterinarian, like, hey, my niece would love to shadow you, or like networking in that regards, trying to find a veterinarian that will help you. Oftentimes, unless you have some experience, it can be hard to get your foot in the door as a technician or a technician assistant. So, working as a kennel technician, I started out as like a kennel assistant. I think like when I was first being paid, working in a kennel, working in a shelter, work like a shelter is a great place because they need people, and there are veterinarians who work in shelters too. So finding, even if you work like with a rescue and there's a veterinarian who works specifically with that rescue, a lot of times rescues contract with local veterinarians for their care, for cost reasons. And so like that, getting your foot in the door a different way, being creative about it is what you can do. And also understanding these things don't happen overnight. So I do feel like sometimes students wait too long and are like, oh, I need this. And unfortunately, that's a relationship you need to be building up from very early on in your career as a student. And so prioritizing that, I think, is important. Anytime I've been asked to write a letter of recommendation, I have to truly know the person and I have to be able to speak to if they're a good candidate or not. So in these relationships don't happen in one or two visits. So I think you have to put yourself out there, make sure that you have a good cover letter, you have a good resume. AAP can help you with that. I know that career services can help you with that as well. So making sure that you have that information, so because that's usually the first thing if you're like emailing or dropping it off, that somebody's going to read about you. And if it doesn't sound genuine, there's grammar mistakes, it doesn't look professional, like they're not even going to give it a second look. So make sure that those things are in order as well when you're trying to go to places to get this get these positions, and just being willing to be patient, shadow. I do know students need money and they have to work in jobs, so I do get that. But anytime if you're in that situation that you can spare to shadow for free to just try to get your foot in the door, and then opportunities may arise from that.
Thank you. Yeah, you're not alone. That's I think my biggest advice too. There are resources all over campus to start small and then end big wherever your goals are. So start asking around. All right, another question from Alex, which is a broad question, but any tips for someone interested in becoming wildlife vet, except for example, places to get experience, things we wouldn't be prepared for, secondary things to learn, like diseases, etc.
Yeah, so again, there are wildlife veterinarians out there. There are going to be fewer. And you do have to, I guess, differentiate if you're just talking wildlife or you're talking exotic, because there are exotic veterinarians and then more like wildlife or zoo veterinarians. So you, for like zoos and wildlife, it's going to be going to organizations who are dealing with those types of animal populations. We have a lot of them here in Orlando in the Central Florida area. We have the Audubon Center for Prey in Winter Park, for birds of prey in Winter Park. We have the Back to Nature Wildlife Rehab. I know there's some places in Christmas that have also wildlife. So it's finding those organizations probably who are more starting with the rehabilitation part. So you're learning about husbandry. Husbandry is taking care of animals. And I think that's a good first step if you're looking for wildlife, and that will teach you those secondary things about diseases that they get, how to handle these animals, understanding that it's different than handling a dog or a cat. There are zoos, local zoos you can volunteer at. There's the was it the alligator Gatorland, I think, that's just south of us. They take volunteers. One of my classmates worked there. All through undergraduate, I remember, and she just loves the reptiles. And so we have a couple of those organizations that are within driving distance here. If you don't have a car here, that obviously makes things more challenging. But if you go home in the summers and you can try to find places there that maybe have better transportation, or you're just gonna have to, be willing to Uber or take a bus. But there are places that you can go to find. And in that particular field, I would start with the rehabs or the zoos, like places you would volunteer to start learning more and understand that field better.
Thank you. And thank you everyone for your questions. These are great. Specific questions, broad questions are all welcome. We're nearing the end of our workshop, but I do want to squeeze in a couple more questions and give everyone time to type their last questions if there are any. But
I would just
I
like
thought
to say like a closing thing when you're done, Steph, too. I know
okay,
I
yeah, of course, of course. All right, then this will be my last question. I thought it was a very
okay.
interesting question. How do you build trust and rapport with your clients and their pets?
Yeah, so I think one of those things I talked about earlier about offering spectrum of care and meeting people where they are at, I think that builds a lot of rapport because clients think, oh, this vet's just trying to upsell me. They're just trying to spend as much of my money as possible. But by offering spectrum of care, I gained a lot of trust from clients and knowing that like they can, when I say like, okay, here we can do a little less and that'll be fine. But here, no, we really have to do this blood work now. Like it's a serious situation. They were more likely to trust me in those instances. And so I think that really helped. getting on the floor with the pets, being very personable. When I walked to an exam room, I would always greet the animal first, and before I greeted the owner, and so that people would comment that they love that, and that I get on the floor with their pets and having patience, especially for my scared patients. I would take the time, I wouldn't be rushed, and so owners really seemed to appreciate that I took the time. Returning phone calls. I mean, I got phone calls all day long, and I would be late at the clinic an hour after I was supposed to be done making phone calls. But that was really an important touch point for clients because they could call and ask a question. And if my staff couldn't field it or answer it, and they felt like I needed to answer it, they would put it on my desk and I would get to it. And clearly communicating expectations. So, always telling clients, like, we're going to do X, Y, Z. I'm going to call you at this time. I don't know the answer to that, but I will get back to you, and then following through. As long as people understood that there was an expectation that I would communicate back with them, they were happy and would be patient with whatever we needed. So I think as long as, and I think that goes for anything really, like if you know what's coming, you're especially in like scary times, it makes it a little bit better.
I can attest to that. The veterinarians that I've interacted with have always been very um, supportive, and I appreciate that a lot.
Awesome. Glad to
All
hear that.
right, yeah. So, if you want to go ahead and close out the meeting, I didn't see any more questions. Again, thank you everyone for your questions. Um,
Yeah, so I just really wanted to say that I know that being going to vet school, being pre-vet can be very competitive. There's a lot of people around you who are 4.0s, who are perfect, who seem to have it together, have all the experience, and are just like, they're going to get in, I'm never going to get in. My favorite thing to tell you guys is stop listening to other people because you are on your own journey. You are on your own timeline. You can make your dreams come true, but it's going to be on your time. And so please, guys, please take a breather every now and then. Don't burn yourselves out now because you cannot go to vet school burnt out. If you get to vet school burnt out, it's going to be really bad. You're not going to be successful. And so now is the time, while you are trying to juggle a lot of things, to still understand that it's okay if mistakes happen. It's okay that things don't go the way they should be or planned. And then also, please, make sure that you are reaching out to your support networks. If that includes counselors, your family, what be it that you are connecting with others and is still trying to enjoy some of this time as a undergraduate student. I do think that students or any pre-health student, I think you guys get tunnel vision sometimes, and all you're doing is focusing on getting in. You don't really think about what's going to come after you actually get in. And it's a whole nother very long, hard, arduous process. And you need to be happy and healthy when you get there. So just know that you are special, you are unique, you are going to get where you need to be, and you don't have to be on everybody else's timeline or perfection level to get there, okay?
Thank you so much for that advice. And just before we close out, I see some people are leaving. We really appreciate, we as an AAP, if you could take a moment to complete our post-event survey. Your responses will help us confirm your attendance for today's session, and we'd love to hear your feedback as well. So I'll drop that in the chat. And Dr. Braun, if you could put your email in the chat as well
Yeah,
so people can reach you easily. I'm sure you're on campus
yeah,
somewhere
yes.
as well.
And if you start typing Charlie Braun in the Outlook 2 box, it should pop up as well. I think I'm the only one on campus. So,
Okay, sounds good. And yeah, visit us at AAP. You can email us with any questions. I'll also drop the link tree that we have so that everyone can see what services we offer, come meet with us, everything. Yeah, thank you so much, Dr. Braun. All your insights were so
yeah,
powerful.
of course.
Hi, thank you so
Thank you
much.
guys.
It was great.
Guess we can wait till everyone heads out.
Steph, you can stop the recording. I think we're good.
Okay, yep.
If
Sorry,
you
I
need
was just answering